Well, did you know that fewer than 5% of all emergency calls are for kids? That's according to the National Emergency Medical Services Information System. This morning, Phoenix Children's is holding a special training to help prepare not only first responders, but really anyone who spends time with children.
Team 12's Jen Wall joins us live this morning. Jen, what is different when it comes to treating kids? Any tips for parents?
Yeah, there's so many tips to share with you. So we're going to start off with this one. You know, when first responders get to an emergency with children, or even when those parents are kind of first starting to ask the questions about what's going wrong, children communicate differently a lot of times than adults. Maybe they can't talk yet, or maybe they'll say things like, my tongue feels funny, meaning they can't breathe. So joining me live right now is Dr. Julie Augustine with Phoenix Children's. Thank you so much for being here. So what are some of the biggest emergencies that first responders get to and bring them to your hospital?
I think some of the most time-sensitive emergencies are drownings, submersion injuries, seizures, respiratory distress, anaphylaxis. Those are our big three, and then trauma, of course.
Yeah, for sure. And I know you see a lot of those right here in the Valley. I mean, some of the most serious cases taken to Phoenix Children's. And so there's a big training symposium going on today with Phoenix Children's and Phoenix Fire to help first responders. Why don't you go ahead and talk about that?
We are really excited. So Phoenix Children's is presenting the second EMS MVP Pediatric Symposium in partnership with the Phoenix Suns and Phoenix Fire. It's actually our 5th year doing the conference, but our 2nd year in this partnership. And truly, we know that less than 5% of 911 calls involve kids. And so when you get there, it's scary, it's challenging, it's something that you aren't seeing 95% of the time. And so knowing that kids present a little bit differently, we know truly every second counts. And we know for the critically ill kids coming to Phoenix Children's or anywhere in the state or the country that every second counts. And so that care really does start way before they get to the hospital. And thankfully, we have well-prepared first responders. And so the event truly is to just to train and re-educate and sort of add updates and continue to practice, bringing our pediatric expertise from Phoenix Children's to not only Phoenix Fire Department, but first responders and nurses and other healthcare providers throughout the country and state.
Wonderful. So helping a lot of different people. So looking at the caretakers, parents, grandparents, what are some things they can do at home if, they're in some really big trouble with the kiddos?
First, I would say injury prevention. So for the little kids, making sure water safety, making sure that you're cutting up, fruits, vegetables, choking prevention. And then I would say in real time, learning things like CPR, knowing if you or a loved one has anaphylaxis, where an EpiPen is and how to use it.
Thank you so much. Wonderful tips there. And really quickly, want to bring on Scott Douglas with Phoenix Fire. How is this training going to help fire departments and first responders across the state?
Well, first of all, thank you to our partners for letting us be a part of this symposium. It's going to help. It's kind of a one-stop shop for paramedics, EMTs, nurses, anybody that wants to come and really get any more knowledge on first responding for kids. So less than 5% of the calls that we run on are actually pediatric emergencies. But those are some of the most important to us. So we want to be really good at it. So we take a lot of pride, and the Phoenix Fire Department, as well as the other members of the fire departments around the valley, are all highly trained and ready to respond to any emergency at any time for anyone's kids if they need to call 911.
All right, wonderful. Thank you. Today's training, a nice booster to all of the experience these EMTs already have and first responders across the state. It is also open to all the first responders. If anybody hasn't signed up yet, you can go ahead and do that. And like Dr. Augustine said, even including school nurses. And that training is going to be at the Footprint Center later on today. For Number Live in Phoenix, Jen Wall, Today in AZ.